This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Group in Oshkosh, and we're going to be talking with Karie Chapman. Now, she's a nurse practitioner, and she's going to be telling us about a brand new program that actually brings providers to nursing homes. Karie, thanks for joining us today. I understand you have a brand new program, and it's going to be a real big benefit to those who are in nursing homes right now.
Yes, actually it's an expansion of an older program in which mid-level providers such as a nurse practitioner or physician assistant is working with the physician to see patients in nursing homes. It was originally established several years ago using other providers in internal medicine such as Jamie Bonnell, where they would go see patients monthly or for acute illnesses. It became such a success that they looked at using it as on an everyday basis. So that's what they did. We are now established in all the nursing homes in Oshkosh that see internal medicine providers. And we are using a nurse practitioner and a physician assistant to do rounds every day.
So how many people are involved with this in terms of being a provider to this program?
Myself and Ken Schlichting, who is a physician assistant. He has been a physician assistant for over 25 years, which brings quite an extensive knowledge base.
And which physicians are involved with this program?
The internal medicine group right now is involved, and we hope to expand that fairly soon. Dr. Blaha, Dr. Lee, Dr. Schrader, Dr. Duffy, and Dr. El-Zubi right now.
All right, so quite a list of physicians involved with this. Now, when you and the other providers go there, you're not replacing the physicians, or are you?
No, absolutely not. And it's always a choice for the resident as to whether they even want to see me or Ken. They always have the option to see only their physician. It's just that this provides immediate contact for any concerns they have. We are collaborating with their physician and partnering with their physician. It's not a replacement in any way.
Okay. Now, this is such a great program. It's cutting down the visits that people have to make actually here to Aurora, and you are getting out to those nursing homes. What can you do at those nursing homes to help people?
There's quite a lot of things we can do in the sense of that we can assess, diagnose, we can manage chronic illness, acute illness, such as something that comes up immediately, from very simple problems to the more complex, managing multiple disease entities. We can order pharmacological therapies, such as medicines that they need, anywhere from pain control to insulins, anything like that. But we can also order non-pharmacological. It's not all about what medicine we can give you. There's other things we can provide, such as physical, occupational therapy, speech therapy. We can also help them with decisions such as whether palliative care is needed or hospice. We can join in at care conferences. We often have family conferences in the rooms. So there's a lot we can provide.
You guys are very busy.
We can be, yes.
Now, besides physicians, do you collaborate with anyone else?
Yes, we collaborate with anybody close to the patient. First and foremost, the patient. It's always a one-on-one. What do you think is going on? How are you doing? We'll collaborate and look for patterns with the nurses closest to taking care of that patient, the CNA staff as well. How are they doing in transfers, walking? And on outward to the dietitian, the director of nursing. We may collaborate with their orthopedic specialists, their surgeons, hospice, palliative care, anything that they need, we will consult with. Physical therapists, absolutely. It's a multidisciplinary, nobody has one answer, it's about the whole person.
Yeah. So I guess in a nutshell, how would you say that the patient really benefits from these nursing home visits?
First of all, it's nice not to wait. Physicians are extremely busy in the office, and they always try to get to the nursing home right away, but there's always those emergencies where sometimes things have to get prioritized. We're there every day, so it's nice. You don't have to wait if you want that one thing to be taken care of. Secondly, a lot of people find it uncomfortable to go to the physician's office, and we can take some of those trips away by seeing them there at the home. It has resulted in fewer emergency room visits because we can see the patterns of what is going on every day and take care of things before they get out of control. less hospitalizations. The studies are showing that there's less hospitalizations. And overall, a decrease in the cost of healthcare over the spectrum, because we're not running up those ER visits, those hospital trips. We're taking care of it right there at home. And that's kind of what it is making this home-based care.
Now, this is a newer program. What has been the reaction from the patients so far that you've seen?
Actually, I've been pleasantly surprised, because I wasn't sure they would understand the concept or what it would mean, and I've been overwhelmed by the gratitude and the excitement. I'm pleased that they're excited about it. Everyone seems to really grasp that I'm there for them every day.
Yeah. Now, if people are interested in having you come to their nursing home, what's the best way to do that?
Right now, it is with the physicians of Aurora in internal med. We hope to expand that to family practice, but right now it's kind of limited to the patients who are right now seeing the physicians of internal medicine. Automatically, if you have a nursing home stay, you will have the option of seeing us. It's just automatically there. It's a service we offer.
All right, Karie, thanks for taking some time with us today.
Absolutely.
If you'd like to know more about this program, you can contact the Internal Medicine Department at Aurora Healthcare at 920-303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.